Happy Wisdom Wednesday, everyone. So this week's book of the week is Predictive Health, How We Can Reinvent Medicine to Extend Our Best Years by Dr. Kenneth Brigham and Michael M.E. Johns. So the idea around predictive health is an interesting one because currently if you look at our healthcare, just here in the United States, about $175 billion is spent on the final year of life. That's a lot of money, and a third of that in the last month. And so the thought is, how do we take some of that money and allocate it earlier on in life? So we're not just focusing on treating the disease, right? But we're focusing on health overall. And more importantly, how do we use things like biological factors, environmental factors, and other things in a healthy individual so that we can use it to predict and prevent those critical illnesses later on. Now, the old definition of health is sort of this passive definition where essentially it's the absence of disease and the physical appearance of looking healthy. And we know that it's not just that simple, and we can look at a variety of different variables that comprise an individual to understand what does it mean to be healthy, and that's where predictive health comes into play. And what predictive health really is about is this intersection of understanding between biology, environment, and social behaviors. Now, if you look at the pandemic, it's a great example of that because we have all those factors at play. Added on top of that, perhaps, is the digital world with social media and how it influences people's behaviors in terms of adopting and not adopting things. So based on what we went through here in the pandemic, the hope is we're able to gather a lot of this data and understanding so that we can essentially predict and hopefully prevent future pandemics from happening. Now, I want to focus more specifically on the medical device aspect, and I want to show you a formula that I came up with that I feel is the formula for what predictive health means in hospitals as it relates to medical devices and medical technology. So let's get over to the whiteboard. Okay, so damn it. Okay, so here's my predictive health formula for medical devices. Now, think about the status quo, which is essentially you have hardware without automation. Perfect example, the stethoscope. It's hardware, but there's nothing automated about it, and you have to physically and manually use it to essentially listen to the heartbeat, right? Well, what happens if we go from status quo to good? Well, what that looks like is that you have hardware with automation, but no software. So a lot of ICUs are already outfitted with this, where they have different devices that essentially pick up a patient's heart rate, okay? Now, what's better than that? Well, better is when you take that same hardware and you have automation to it. So you get hardware with automation, meaning that you don't have somebody having to manually write down the data, right? It's automatically happen. But you add software to that. So perhaps that goes into electronic medical records. So you have automation in the hardware, so there's no human factor in it. And then the software side, you're starting to see data and hopefully start developing trends. So you can see with patients what's happening with their heart rate as it relates to critical illnesses, right? As a human being. What's the best, and this is where predictive health really comes in, is we take hardware with automation, we add software that gives you data and trends, and then when you have infinite data, guess what you can do? You can add this piece right here, algorithms. And of course that later on goes on to AI so that you can start understanding from not an individual but populations of people what are the data and trends in these illnesses and physiology that we can use to start predicting and preventing. Now, this is just from the disease state. The bigger part of predictive health is that not only doing this in the hospital setting, but going backwards all the way to the healthy individuals who start understanding and having a more holistic look at health, not just from the disease state. Now, one of my good friends and former colleagues, Santosh Iyer, who is actually out in Boston, just finished his MBA over at Harvard, was really interested in this. He's going to be one of those future healthcare leaders in this arena. He put together this amazing infographic. Actually 2 years ago, having a more holistic view of what predictive health means, not only in the hospital setting, but also in the consumer setting, in the patient's home, and again, before they're even quote-unquote a patient. That's where all these different wearable devices are implemented, but more so based on social media and a variety of other factors, we start understanding the other aspects of health, which means the behavioral aspects of it, the environmental factors of it, and when we combine all these things together, again, with all the infinite data that we have, we'll hopefully be able to start moving towards predictive health. Well, it's not just about disease management, but more importantly, what is an overall look of a healthy individual look like, and how do we start predicting and preventing these diseases? So that's your book of the week. I think it's fantastic because, again, they cover a variety of different areas such as genetics, biology, medicine, and give a great overall summary of what this should look like in the future. So hope you enjoy this review. Go out and get it. If you haven't already, subscribe to my channel and leave a comment below. And as always, happy Losing Wednesday, and I'll see you next week.